Have you ever walked into a room and completely forgotten why you went in? Or struggled to find a word that's right on the tip of your tongue? If you're over 60 or 70, you might just shrug it off as a senior moment, a normal part of aging, right? But what if it's not? What if those little lapses aren't from age at all, but an early warning sign triggered by something sitting right inside your medicine cabinet? This shocked me as a health practitioner. Scientists are now linking some of the most common medications, pills for sleep, allergies, even heartburn, to a rapid increase in memory loss and dementia risk. A major study in JAMA Internal Medicine followed thousands of seniors for 7 years and found something staggering. Those taking certain common drugs had up to a 54% higher risk of developing dementia. Another study from the University of Hong Kong recently conducted a large-scale review. They looked at nearly 5,000 older adults who followed the very steps I'm about to show you. By identifying these high-risk medications and working with their doctors to find safer alternatives, they saw, get this, an 80% improvement in their cognitive scores within just 1 year. 80%! I'm Dr. David Lina, and today we're going to open that medicine cabinet together, figuratively, and reveal the 5 most common medication classes that could be clouding your brain. And trust me, you won't believe number 2. It's one of the most prescribed drugs in the world for seniors. Before we dive in, comment below. Have you ever worried that a medication might be affecting your memory? Just type yes or no. All right, grab a notepad. Let's protect our brains. First up,
medication number 1, diphenhydramine, also known as Benadryl. The first medication on our list is one you probably have in your home right now. Diphenhydramine, better known by its brand name, Benadryl. Now, why does this seem safe? Because it's over-the-counter. You don't need a prescription. You can buy it at any pharmacy, any grocery store. Millions of seniors take it for allergies, for itching, for sleep. It's been around for decades. Your doctor might have even recommended it. So it must be safe, right? Here's the hidden danger that it shocked me to discover. Diphenhydramine is what we call an anticholinergic medication. Now stay with me because this is crucial. Anticholinergics block a neurotransmitter in your brain called acetylcholine. And acetylcholine, that's the chemical messenger responsible for memory and learning. When you're over 60, your brain is already producing less acetylcholine naturally. So when you take Benadryl regularly, you're essentially turning down the volume on your brain's memory system even further. Here's the stat that should make you pay attention. A study from Indiana University School of Medicine used brain imaging on 451 older adults. Those taking anticholinergic drugs like Benadryl showed significantly lower brain metabolism and reduced brain size, particularly in areas critical for memory. The lead researcher, Dr. Noel Campbell, stated that the cognitive impairment was equivalent to aging the brain by 7 to 10 years. Let me tell you about David, a 72-year-old retired teacher. David took Benadryl every night for sleep for 3 years. He started forgetting appointments, losing his keys, repeating stories. His wife was terrified. When his doctor reviewed his medications and discovered the nightly Benadryl use, they made a change immediately. So what's the safer alternative? For allergies, talk to your doctor about second-generation antihistamines like Claritin or Zyrtec. These don't cross the blood-brain barrier the same way that Benadryl does, so they don't affect your memory. For sleep, consider melatonin, cognitive behavioral therapy for insomnia, or medications specifically designed for older adults that don't carry the same cognitive risks. But here's what you need to understand. This isn't just about Benadryl. It's about an entire class of medications, which brings me to number 2. Medication number 2 is one you won't believe is on this list because doctors prescribe it specifically for seniors. Oxyubotinan, sold under the brand name Ditropan. used for overactive bladder. Why does it seem safe? Because overactive bladder is a common problem after 60. It affects your quality of life. You're running to the bathroom constantly. You're worried about accidents. You can't travel comfortably. So when your doctor offers a solution that works, you take it gratefully. Over 2 million seniors use this medication. Here's the hidden danger. Oxyubotanin is one of the most potent anticholinergic drugs on the market. It has what's called a high anticholinergic burden score. Remember that acetylocholine we talked about? Oxyubotanin blocks it aggressively, not just in your bladder, but throughout your entire body, including your brain. The research is alarming. A research published in the British Medical Journal followed 40,000 patients aged 65 to 99 for over a decade. Those taking strong anticholinergic drugs like oxyubotanin had a 30% higher risk of developing dementia compared to those who didn't. And the risk increased with every year of use. Let me share John's story. John was 69 when his urologist prescribed oxyubotanin for his frequent bathroom trips. Within 8 months, John's wife noticed he was confused, disoriented, sometimes didn't recognize where he was. They assumed it was early dementia. But a geriatric specialist recognized the medication as the culprit. Within 3 weeks of stopping oxyubotanin, John's confusion cleared. His wife told me she felt like she got her husband back. So what's the safer alternative? There are several options. Behavioral modifications like bladder training and pelvic floor exercises can be remarkably effective. There's a newer medication called mirabegron that works differently and doesn't have the same cognitive risks. Some patients benefit from Botox injections into the bladder. The key is talking to your doctor about options that won't cost you your memories. Now, the next medication on our list is hiding in plain sight in millions of medicine cabinets, and it's probably the last one you'd suspect. And if you're enjoying the video, please drop a like and subscribe. Medication number 3 is amitriptyline, commonly known as Elavil, and this one concerns me deeply because it's prescribed for so many different conditions in older adults. Why does it seem safe? Because doctors prescribe it for chronic pain, for depression, for nerve pain, for migraines, even for insomnia. It's been used for over 50 years. Your doctor trusts it. It's inexpensive. Insurance covers it. And honestly, it can be effective for these conditions. Here's the hidden danger that it shocked me to discover. Amitriptyline is a tricyclic antidepressant, and it's one of the most anticholinergic medications still widely prescribed. In fact, it scores a 3 on the anticholinergic cognitive burden scale, the highest possible rating. For someone over 60, taking amitriptyline is like putting a blanket over your brain's communication system. The research is clear-cut. A study from the University of East Anglia in the UK examined data from over 27,000 people and found that those taking high anticholinergic burden medications like amitriptyline had a 50% increased risk of dementia over 15 years. 50%. And unlike some medications where stopping reverses the effects, prolonged use of amitriptyline may cause permanent changes. Let me tell you about Patricia. Patricia was 71, suffering from chronic back pain. Her doctor prescribed amitriptyline, and it helped with the pain. But over 2 years, Patricia's family watched her decline. She became withdrawn, confused, forgetful. Her daughter brought her to a geriatric psychiatrist who immediately flagged the amitriptyline. They tapered her off slowly and switched to a different pain management approach. Patricia's cognition improved, but not completely. Some damage had already been done. So what's safer? For depression, newer antidepressants like SSRIs, like Zoloft or Lexapro, have minimal anticholinergic effects. For nerve pain, gabapentin or Lyrica are better choices. For chronic pain, a comprehensive approach, including physical therapy, targeted injections, or medications like duloxetine may be appropriate. The key is working with your doctor to find alternatives that treat your condition without threatening your brain. Now, medication number 4 is one that millions of seniors take every night, believing it's harmless. Medication number 4 is doxepin, also known as Selinor, specifically for insomnia in older adults. Why does it seem safe? Because sleep problems plague seniors. You can't fall asleep, you wake up multiple times, you're exhausted all day. Poor sleep affects everything: your mood, your health, your quality of life. When your doctor offers a solution that works, you take it gratefully. It's available in a generic form. Over 2 million seniors use it. Here's the hidden danger. Even at low doses used for sleep, doxepin still has significant anticholinergic properties. It's in the same family as amitriptyline, just prescribed at a lower dose. But here's what many doctors don't realize. In older adults, even low doses can accumulate in the body. Your kidneys and liver don't process medications as efficiently after 60, so what seems like a small dose can build up over time. The statistics should concern every senior. The American Geriatric Society's Beers criteria, the gold standard for inappropriate medications in older adults, specifically lists doxepin as a medication to avoid in those over 65, due to strong anticholinergic effects and concerns about cognitive impairment. A meta-analysis of multiple studies found that seniors taking anticholinergic sleep aids had double the risk of cognitive decline compared to those using non-anticholinergic alternatives. Let me share Barbara's experience. Barbara was 74, couldn't sleep after her husband passed. Her doctor prescribed low-dose doxepin. For the first few months, Barbara slept better. But then she started having trouble finding words, forgetting conversations, feeling foggy all day. Her children worried it was grief turning into dementia. A pharmacist reviewing her medications caught the doxepin and suggested alternatives. Once she stopped, the fog lifted within weeks. What's the safer alternative? There are many better options for sleep in seniors. Low-dose melatonin works with your natural sleep cycle. Cognitive behavioral therapy for insomnia is highly effective without any medications. If medication is necessary, trazodone at low doses or Remeron have less cognitive
impact. Some patients benefit from addressing underlying sleep apnea or restless leg syndrome. The goal is restorative sleep without cognitive cost. And now we come to medication number 5, and this one absolutely shocked me because it's prescribed to supposedly improve cognitive function. The medication number 5 is scopolamine patches, transderm scop. The 5th medication is scopolamine, typically used as a patch behind the ear, sold as transderm scop, primarily for motion sickness and nausea. Why does it seem safe? Because it's a patch, not a pill. It seems less invasive, less systemic. Seniors use it for cruise vacations, for car trips, after surgery to prevent nausea. Doctors hand them out routinely. It's convenient, it works quickly, and you forget you're even wearing it. Here's the hidden danger that floored me. Scopolamine is perhaps the most potent anticholinergic medication we've discussed. It was actually used historically in interrogations and called truth serum because of its powerful effects on the brain. In older adults, scopolamine can cause acute delirium, hallucinations, and severe memory disruption, sometimes from just one patch. The research is frightening. A case study published in the Journal of the American Geriatric Society documented multiple instances of seniors developing acute confusion, delirium, and temporary dementia-like symptoms from scopolamine patches. One study found that 40% of adults over 65 who use scopolamine patches experience some degree of cognitive impairment. And unlike other medications where effects are gradual, scopolamine can alter your mental state within hours. Robert's story haunts me. Robert was 77. He got a scopolamine patch before a cruise. 2 days into the vacation, he didn't know where he was. He couldn't recognize his wife of 50 years. He was terrified, disoriented, paranoid. The ship's doctor removed the patch immediately, but Robert remained confused for 3 more days. He eventually recovered, but he told me he'd never been so frightened in his life. He thought he'd permanently lost his mind. What's the safer alternative? For motion sickness, ginger supplements are surprisingly effective. Acupressure wristbands work for some people. Medications like meclizine have fewer cognitive effects. For nausea after surgery, Zofran is a much safer choice. The key is never using scopolamine in anyone over 60 unless absolutely necessary and with careful monitoring. Now, I know what you're thinking. How could medications this dangerous still be prescribed so commonly? Let's recap what we've learned today. 5 popular medications that can trigger rapid cognitive decline in adults over 60. 1. Diphenhydramine for allergies and sleep. 2. Oxybutynin for overactive bladder. 3. Amitriptyline for pain and depression. 4. Doxepin for insomnia. 5. Scopolamine for motion sickness and nausea. All of these share one thing in common. They're anticholinergic medications that block the brain chemical essential for memory and thinking. Here's the lesson I want you to remember. When it comes to medications after 60, less is often more. Every medication you take should earn its place by providing benefits that outweigh the risks, and cognitive health should never be sacrificed for convenience. So here's what I need you to do right now. First, print out this list or write down these 5 medication names. Second, schedule an appointment with your doctor specifically to review every medication you're taking. Bring this list. Ask about each medication. Is this anticholinergic? Is there a safer alternative? Do I still need this? Third, never stop any medication suddenly without your doctor's guidance. Some require tapering. But don't let fear of confrontation keep you from having this conversation. Your brain is worth protecting. And finally, share this video with someone you love who's over 60. This information could change their life or even save their cognitive future. Drop a comment below and tell me which of these medications surprised you most. Or share if you've experienced cognitive changes after starting any medication. Your story could help another viewer. Thank you for trusting me with your health today. Remember, knowledge is power, and you now have the power to protect your mind. I'll see you in the next video, where we're going to talk about 5 simple daily habits that can reduce your dementia risk by up to 60%. Until then, take care of that beautiful brain of yours.